All right, welcome back. February is American Heart Month, as we've been telling you and reminding you. So this morning we're talking about what's called a coronary calcium score. It's actually a measurement that can help a doctor identify who is at risk for heart disease before a person has signs or symptoms. And Touro Cardiologist Dr. Glaser joins us now to tell us why knowing this score is actually really important for your health. Thank you so much for being here with us, Doc.
Thank you so much for having me.
Yeah, absolutely. So this is a really interesting metric because we've come a long way from just waiting for the symptoms and then having the emergency. When is it okay to ask for this score to be calculated for your own heart?
It can never be too early to ask. The more we know, the more we're able to stratify your risk and kind of know what to do next to hopefully prevent anything from happening in the future.
What is a calcium score?
So a calcium score is a special kind of test, a CT scan, non-invasive study that allows us to know how much calcium or plaque is built up around the arteries in your heart.
And so when you see that a person has a certain number, what do you do and what is that number?
So the number changes a little bit depending on your age. 0, the lowest number you can have, would indicate that you have a very low risk of having a heart attack, a stroke, anything like that over the next 5 to 10 years. The higher the number, the higher the risk.
Okay.
And then that would kind of dictate how aggressive we need to be in treating things like blood pressure, cholesterol, diabetes, exercise, obesity, kind of the overall picture for you.
So is there a certain age at which you should start asking for this?
Typically, we say around age 40 is when a lot of the studies have said is a good time to start. And there's really no upper age for it either.
Mm-hmm. Interesting. Okay, so one of the things that we spoke about in the hallway was the cost of this. You said it's $100.
Yeah, $100 out of pocket. We're able to do it at Touro. And again, it gives us a ton of invaluable information to know kind of what we need to do next and what your risk is.
And so tell us about the typical patient that does have a high score and ways of preventing this score from being high.
Yeah, the typical patient, really you'd be surprised. It could be a lot of people just kind of age into having the score being a little bit elevated, but otherwise obesity, again, cholesterol, family history is a big driving factor. If you have family history of heart attacks, strokes, high cholesterol, things like that. Would be the main drivers that might make it elevated.
And how do you bring it down?
Once your score is elevated, you're not really able to bring it down.
Really?
Once the plaque is there and the calcium is there, it's kind of there going forward. So that's why it's so important to catch it early. Once we start to see these numbers start to trend up, we start treatment early and reduce a lot of these risk factors and prevent the plaque or calcium from ever forming.
So tell us more about the actual screening. What is the process like?
So you'd come into to Touro. It's an outpatient procedure. Lay on a scanner for about 5 minutes. That's it. No IVs needed, non-invasive, anything like that.
Wow. What took so long for this to become standard?
It's been coming for the maybe past 5-10 years, but really having the data to back up what these numbers mean. We could have the numbers a long time ago, but knowing what to do with it, I think has taken a little bit of time.
And in the last 30 seconds, what do you do with it as a patient and as someone treating someone with a higher score? What do you do with those numbers?
Again, what we would do is just know if your number is 0, kind of just keep monitoring, going forward, doing the typical lifestyle stuff. If the number's high, we might need to change your medication dose, change the medications you're on, start looking for some other risk factors you may have to prevent that plaque from progressing. So 5-10 years down the line, that number is still low.
Dr. Glaser from Touro Cardiology, really appreciate your time with us today.
Thank you so much.